Good afternoon. My name is Stacy Forte. I'm a BSN to MSN student, and today I have my patient, Michelle Bledsoe. We're going to be doing a skin assessment. She just came to the unit, so I'm admitting her to the unit, so I need to do a set of vitals on her. Then I'm going to assess her skin, but before I do all of that, I'm going to get a brief family history on her. Good afternoon, Miss Michelle. My name is Miss Stacy. I'll be your nurse today. How are you?
I'm not well.
What's going on today?
I have some bumps. I don't know what they are. They kind of itch. I've tried lotion. I've tried creams. First trip to the doctor, I don't know what's going on with it. They're kind of embarrassing. They come and they go, but when they come back, they seem to spread, and I don't know what's going on with all that.
Okay. How long have you had these bumps?
Oh, I can honestly say a while, but to pinpoint a day, I don't really know.
Okay, well let's first do this.
Okay.
I'm going to be teaching the pre-licensed nursing students on how to do skin assessments. But the first step we always need to do when we're dealing with a patient, we need to do a quick set of vitals.
Okay.
So I'm going to get a quick set of vitals on you,
Okay.
and then we'll go from there. The blood pressure cuff is going to get a little tight, and then it'll release. Okay, your blood pressure is good. You're 118/62, and that's a good blood pressure. I'm going to take this back off your arm. I'm going to do a couple more things, and then we're going to take a look at those bumps. Got a real good pulse.
Well, I'm a little nervous right now, too.
Okay, well, we'll try to relieve some of those nerves, okay? Okay, your pulse is 78. What I'm going to do is I'm going to have you take some deep breaths for me. Okay, take a deep breath in. Breathe out. Again. Breathe out. Going to pull your cover down, not to expose you. Breathe in. Breathe out. Breathe in. Breathe out. Going to have you sit up for me and do the same. Take a deep breath. Let it out. Again. Let it out. Again. Out. One more time.
I'm out of breath.
Okay. Your lungs sound good also. What I'm going to do is I'm going to cover you up with a blanket. And as I look at your skin, I'm going to keep you completely covered. So what I'm using is called a bath blanket. So what I'll do is I'll just cover you up with this blanket so you're not exposed. Hopefully no one will barge in the room while we're taking a look at these bumps that you have. Okay, I'm washing my hands. I'm going to put my gloves on. Now with these bumps that you have, you said they're itchy. Do they have any drainage, or are they open, or can you see them?
I really can't see them unless I stand just the right way in the mirror, but no drainage that I can tell.
Okay. What I'm going to do is I'm going to take a look at the bumps. I'm going to take your cover here and pull this over. And you said they're on your legs?
About my hip area maybe,
Okay.
and a little bit towards my back.
Okay.
Small on my back.
Okay, I do see the bumps. They're a little red, raised. They have pus in them. Can I get you to roll that way and hold your rail so I can take a real good look while I keep you covered here? Oh yeah, I see that. Okay. Now, does that hurt when I touch on them?
That one did.
Okay, this one right here?
That one did.
Okay.
Uh-huh.
What about these over here?
A little tender.
Okay. What about the ones on the hip?
That's sore.
Okay.
That's pretty sore.
Now, I notice you have an opening.
Oh.
Now, long have you had this opening on your buttocks?
Oh, that's been there a couple months at least.
Okay. Have you notified your doctor that you have this open
I
wound?
don't go to the doctor. I hate doctors.
Well, you might want to go to the doctor because we're going to have to do some treatment with this wound here.
But I'm not real crazy about that idea.
Okay, what I'm going to do is have you stay on your side a bit to take some of the pressure off. I'm going to take my gloves off and wash my hands. And I'm going to document the different wounds that I see.
Is it something contagious, you think?
Well, I'm not sure. What we're going to do is we're going to get a specimen.
Because I got kids and grandkids that come over sometimes, and people like to sit on my furniture. So I don't want them to get.
Well, what we're going to do is we're going to get a culture of it. Now, I'm looking at that, but I want to take a look at the rest of you here. Okay, don't see anything there. Take a look at your legs. Okay, does that hurt on your legs?
Oh, only when you push on it a little
Okay.
bit.
Well, I don't see anything. You do have a little swelling. It's called edema.
Yeah.
So when you're lying down or sitting,
Is that from my diabetes, you think?
it could be from having your legs dangling.
I see.
We want to keep them, propped up where the legs are elevated a little higher than the heart. Okay, I'm covering you back up.
Okay.
Then take this blanket back off of you.
I see.
Okay, putting the blanket in a soiled container here. Now, what medical problems do you have?
Oh, I've had diabetes, it seems like forever.
I'm gonna raise your head up a bit.
Alright. I got high blood pressure, they tell me, but then, I don't know. Maybe that's why I get, hard to breathe when I walk, and I don't know.
Okay. While you're turned over like that, I want to listen to your belly real quick.
Ooh, that's cold.
Well, I'm sorry that it's cold. I tried to warm it up.
Hospitals just, they wear me out.
Okay. Well, you have good bowel sounds. Do you have regular bowel movements?
Oh, yeah.
Okay. And how much do you drink per day?
What are you talking about? What do I drink every day?
Water, sodas,
Oh.
tea.
Water. I don't drink water. I don't like water. Tea.
8 minutes, it's 8.
Okay. Do you use any alcohol on a regular basis? Beer, wine, hard liquor? Not sure. Do you smoke?
Oh, I don't smoke, but yeah, well, sometimes if we go to the bar, then I'll drink
Okay.
and I'll smoke if I've had a few too many whiskey sours, but not
Okay.
too bad. I don't drive, of course.
Well,
I
that's
do drink
good.
it, yeah.
This concludes our SIN assessment with our patient, Michelle. And it teaches a pre-licensure nursing student how to take a complete skin assessment from head to toe. Also ask them other questions that may be pertinent. Thanks for watching my video.